Hello, my name is Keith Harris, and I am a family medicine physician for Baptist Medical Group. Today, I will be talking with you about advanced care planning. So what is advanced care planning? We see advanced care planning as a gift to your loved ones. It allows your loved ones to make difficult decisions on your behalf if ever there is a time you cannot speak for yourself. It relieves the emotional burden of family members having to make a difficult decision on your behalf. So why is advanced care planning important? Because it puts you in the driver's seat of your healthcare decisions. With this plan in place, it helps others speak on your behalf and say what you would want to say. No one wants to think about the what ifs. But there are times when we need to have this discussion, and we create this important tool that your loved ones can use down the road. An advance directive is also important because it helps protect against backseat drivers, such as family members who don't really know or understand your wishes. Completing an advanced healthcare directive allows you to put your healthcare wishes in order. What are some benefits to advanced care planning? Well, a person's voice can be heard even if they can't speak for themselves. Their family or healthcare agent can be relieved of the moral guilt of having to make a difficult decision for them. Instead, they'll have clear direction and simply be speaking what the person has already said they want or don't want. A person's wishes and preferences can align with the treatment that they actually receive, and a reliable document can be stored and retrieved when necessary. So why are people hesitant to begin this process? Well, there are many reasons. Some people say, "I'm not that sick," or "This is all just too confusing." Others may say, "I've already talked to my lawyer, but a plan has not been finalized," or "Nothing is going to happen to me." A few may feel that it might be bad luck to even work on such a plan. Many will say, "I'm sure my loved ones already know what I want." Others will think, "I don't want to talk about my own mortality," or "I don't like difficult conversations about such things." And some people are just plain old procrastinators who have every intention of completing a plan, but never seem to get around to doing so. There are some things we want to consider when completing our advanced healthcare directive. One item is aging considerations. What would I want as I age? What would my loved ones need to provide for me and speak on my behalf as I age? What if I have dementia or some other cognitive decline? What if there's a chronic illness such as congestive heart failure, diabetes, cancer, or emphysema? What if there's a functional decline? What if I can no longer walk or I lose the ability to use my hands? Other things to consider would be unexpected events, a car wreck, a serious fall, a sudden illness such as a heart attack, or even a pandemic. Most never saw the COVID pandemic coming. One thing that happened during the pandemic, some hospitals, being so overwhelmed, had to consider a universal do not resuscitate order. What would you have wanted for yourself during this time? We all should have this conversation with our loved ones. A major item to consider is the need to choose a healthcare agent very carefully. This person should know what's most important to you, what your goals, values, and beliefs are, where you desire to live, where you would want to die, when medical decisions should be continued or discontinued, and what resources are available to use, such as a long-term care insurance policy or any veterans benefits. The person you select should be someone you can talk to discuss your goals and values with in detail. If someone doesn't want to talk about these things, you may not want to select them. This person should be willing to accept the responsibility. Make sure you ask them first if they are willing to take on such a responsibility. They should be able to follow your wishes, and they will need to be able to make decisions in stressful situations. There are many healthcare directives documents out there. There is nothing magical about any document, but you do want to pay close attention to the witnessing requirements. In the state of Mississippi, the requirements are 2 witnesses or a notary, and you will have to sign that document in front of either the 2 witnesses or the notary. We always recommend that you think outside the box. You don't necessarily have to include whatever is on the form. You can add extra things, whatever is important to you. We also recommend using a wallet card notifying individuals that you have an advanced care directive. Your plan is dynamic. You can review and update your plan at any time. Every 10 years or so, you might want to review your document. Pull it out, blow the dust off, and see if it still honors your goals and wishes. If there's a death, you want to review your document because it's pretty hard for a person to speak on your behalf if they're no longer living. If there's a divorce, you want to review your document and see if it needs updating. If there is a new medical diagnosis, review your document to see if it still honors what you would want. What would I want in a particular season of life? What if there is a decline in my health? If there is a decline, you want to have a conversation to see if your goals and wishes still are reflected in your advanced healthcare directive. This is a very important point. As long as you have decisional capacity, you can change your advanced healthcare directive at any time. And as long as you have decisional capacity, the healthcare team will come directly to you to ask what you would want. This document only comes into play when you can no longer speak for yourself. If you develop a more serious illness, you want to consider a more detailed document that will explain how your disease will likely progress and what your wishes will be as it does. Have a conversation with your physician early so you can document your plans. Next, we will discuss a POLST. A POLST is a supplementary document that comes alongside the Advanced Healthcare Directive, and it stands for the Physician's Order for Life-Sustaining Treatment. A POLST is a medical order. It's a pink document that is portable. This document transfers from one location to another. So if a person is at a hospital and they go to a skilled nursing facility or a step-down unit or even back home, a POLST will transfer with them. It's recognized throughout the state of Mississippi. Not everyone would fill out a POLST. The POLST is typically filled out by someone with a chronic, progressive, or very serious illness, or maybe someone who is medically frail, or someone who, at an advanced age, just does not want an attempt at resuscitation. There are several parts to the POLST document. Part A stipulates that if I no longer have a pulse and I'm not breathing, which means the person has passed away, would you want an attempt at resuscitation? Think about the resuscitation process. What will be done to me? The long-term survival rates after resuscitation are surprisingly low. Keep in mind, the person who fills out a POLST is someone who is chronically ill, medically frail, and usually quite sick. That person may or may not want a resuscitation attempt. They may not want to go through the entire process. Part A allows a person to choose, yes, I want an attempt at resuscitation, or no, I do not want an attempt at resuscitation. Keep in mind, Part A only applies when a person has no heartbeat and they're not breathing. A no resuscitation choice does not mean do nothing while the person is still living. Your healthcare team will still treat you if you have a pulse in your breathing. We will explore this more in Part B. When deciding your choice on Part A, careful communication is necessary when completing this document. This is why it is an actual physician's order and will need to be discussed with your physician. Again, CPR is really not what it looks like on television. Talk to your healthcare provider about what CPR actually entails. Part B of the document deals with more complex issues. What if I have a pulse and I'm breathing, but I'm unresponsive? What type of medical intervention would I want? Would I want aggressive, full treatment? Would I want to be intubated, ventilated, and placed in the intensive care unit? Would I want this indefinitely, or would I only want this for a trial period to see if my acute illness can be easily corrected? Would I want just a selective treatment, such as a medicine, fluids, but no intubation? Or would I simply ask to be kept comfortable as nature takes its course? Part C of the document addresses artificial nutrition and artificial hydration. Do I want a feeding tube? If yes, would this feeding tube be for the long term? Part D of the document deals with signatures. The document will need to be signed by the physician and the patient or the patient's medical decision maker. Remember, it can be updated at any time. Do you know the difference between palliative care and hospice? We will now talk briefly about palliative care. Palliative care is comfort care provided during any phase of a disease process. At any phase, a year out, 2 years out, 5 or more years out, you can receive palliative care to manage symptoms for a chronic illness. Hospice care is also palliative care, but is more intensive comfort care. This is provided when the prognosis is 6 months or less. You typically tend to have a more robust team with the hospice benefit. The following slide shows how this works a little better. When a person is initially diagnosed with a chronic illness, they receive more curative care and less palliative care. As they go along the trajectory of the disease process, they receive a little bit more palliative care and a little less curative care. Finally, when the disease has progressed where a person now has a prognosis of 6 months or less, they will be offered the hospice benefit. I wish to thank you for your time, and I hope you have a great day.